into why that occurs, because then that affects like the treatments that we spectrum of ways to treat arms, and they range from less invasive things to more invasive things. And the approach for your treatment really depends on like what's going on with the arm. So we'll talk about each of those and like when you would choose one treatment option versus another. And then we'll talk about some of the nuances and advancements in arm treatments, and some of the things that like make the brachioplasty that I do different than just about everyone else. And then we'll talk about recovery, the process of sort of like getting from consultation to your new arms, and then frequently asked questions, things that come up a lot when we talk with people about brachioplasties. So a little bit about myself. I'm a board certified plastic surgeon. I did most of my training on the East Coast, so like New York, Boston, a lot of time in DC. I'm also from the Midwest, so I grew up in Ohio and I did some training in Indiana. And then I'm part of the American Board of Plastic Surgery, the American Society of Plastic Surgeons, and the American Society of Aesthetic Plastic Surgeons. This is my team. These are sort of the clinical staff, the people that are providing treatments. I also have a PA, Sia, who's not on here. But I wanted to point out Denasia and Diana, because these are the nurses that work with me in helping getting people ready for surgery, and either will assist in the preoperative clearances or letting you know what sort of things need to be done in order to optimize your outcomes or what to be ready for, or actually help me during the procedure. The admin team, Scarlett's a really good person to know because she is the surgery concierge, so she's the person that provides quotes, knows my schedule, helps set all of your appointments. We like to actually have all of your follow-up appointments scheduled prior to your procedure, so you sort of know exactly what like the recovery process will entail. So a little bit about my story. So I was originally recruited to Florida by a practice that specialized in arm liposuction. And they did a pretty cool sort of like unique arm liposuction thing. And they liked me because I had a lot of experience in this sort of awake liposuction as well. And so I was able to sort of use my experience and sort of their patients who came from really all over the world in order to have arm sculpting and shaping done. The problem with liposuction in the arm is that it's really for a pretty small or narrow patient population, because you have to have really good skin elasticity in order to tolerate that deflation effect of taking out the fat. And so I came to realize that arm liposuction alone sort of failed a really large, or really probably most of the patient population, okay? Yeah, and so, but what I did find was that when you combine the benefits of shrinking the arm and sculpting the arm with the arm lift part, that's really where you can get some like cool outcomes. And I think that's the direction that brachioplasties are really going. I think that like people are doing a lot of these, are doing it well, are combining some amount of liposuction with the arm lift in order to sort of get the added benefit. So this is actually like a photo of one of like the early patients when I was doing arm liposuction and a brachioplasty at the same time. And this is one of those patients where you sort of have this like aha moment. That sort of, you're like, you know what, I'm onto something here and I'm gonna take this in like another direction. And so what we did with this patient is we did the liposuction to evacuate the volume, but we left her with all this extra skin. So this is a patient who never could have had liposuction alone, but when you do the liposuction and you shrink the arm and you get all the volume out of this area, you're able to then lift it and get something that sort of looks like that. And suddenly the arms match her body and you know, it all sort of comes together. So that idea of like using liposuction in arm lifts, like I said, I think that's really like, this is sort of like the horizon of arm treatments. And because of that, you know, we've been treating people from really all over the country. These are all the states that people have come from. It's a little bit old. We've hit Vermont. We're still missing the like North and South Dakota. So if anyone out there is from North or South Dakota, I'm like dying to have you come in. So let's talk about like why people like want brachioplasties to come to see me. It's usually some combination of either too much skin, too much volume, or too much volume and too much skin. And so when you've got too much skin, in patients who have too much skin, the arm has good size or shape relative to the rest of the body. You can see the contours of the muscle, but the skin hangs when the arms are extended. And so you see the loose hanging skin. You also tend to see that the skin bunches up when the arms at their side. And people who have too much skin typically say, you know what, I avoid wearing like short sleeve shirts. Like this makes me uncomfortable. And especially in Florida where like we're in short sleeve shirts all the time, like we just hear that over and over again. People who have issues with too much volume, well, a lot of times they'll say, well, I feel like my arms are too wide. Like the upper arm is out of proportion with the rest of my body. You don't see the contours of the shoulder as much because there's the fat pad that sort of develops on the side of the arm, and it makes the arms look wide, and it makes the entire patient look wider. And so they say, yeah, it makes them feel wide. A lot of times will say, I feel like a linebacker. I feel wide. And so these patients are saying things like, well, I can't fit my arm into sleeves, or I need to like buy a shirt that's like a larger size just in order to like accommodate my arms. And then the too much volume and too much skin is sort of this combination of both things. Is that the arms feel out of proportion with the rest of the body. You also have the skin and the volume that hangs, and when you put your arms down the side, you see the wrinkles. And these patients are just like, I really have struggled with my arms for a long time, and I'm over it. I can't. And so, like, why does this happen? Why do these things occur? Well, it's really about elasticity. So I love this analogy of a balloon. If you blow a balloon up and you let the air out of it really quickly, well, the balloon still has elasticity in the way that it will contract. But if you blow a balloon up and you leave it expanded for 5 years and then let the air out of it, it comes together kind of wonky. So what we're talking about here is a loss of elasticity plus a loss of volume. And when that happens, that's when we see like the kind of things that I'm describing. And so what does that look like? Well, we can see this all over the body. We see it in the face, we see it in abdomens after babies, we see it in the breasts after babies. In the arms, it can look something sort of like this. So this was a patient who sent me some photos of back when her arms had a little bit more volume. She still had problems with them, but as she started to lose weight, she started to notice that like the skin was getting looser and the problem seemed to sort of like be like precipitating a little bit more. And anyway, remember this dress because this same patient is actually this patient, and she's got like the loose skin and it's kind of hanging, and then there's that dress again. This is that same patient. So she was able to go from something like this to something like this because of like the brachioplasty. So that's why this is like such a powerful procedure. And so like these are the kind of things that just like energize me and make me really excited about this. Because people who have like challenges with their arms, like, I mean, after talking to a lot of people about this, like, they really struggle with it. Like, it affects their lives. It affects the way that the clothes they wear, like, what they feel comfortable doing. So anyway, I get amped about this, and I really love this procedure. So what are the treatment options? Well, with anything, there's a range, there's a spectrum. And so if you think about, like, people want to know, like, well, give me everything. Are there natural treatments? Are there non-surgical treatments? Obviously, the brachioplasty is a surgical treatment, but what else is out there? So when you talk about natural treatments, you're talking about, like, really preventative stuff. Resistance training, nutrition, hydration, all of that's great for prevention when you're 20, but this doesn't help someone like this, okay? Once you've gotten to that, like, there's no amount of like skin lotion or potion that you can use that's gonna get you the amount of skin reduction to like really get you to the place you want to be. So the thing I tell people is, like, if you can buy something at a grocery store, like, it's probably not super effective, right? Like, some things that work like are regulated by like the government. Non-surgical treatments, things that help create contraction, are typically things that heat tissue. So they've come up with a lot of technologies in order to help heat skin and create collagen contraction. So there's lasers, there's radio frequency devices, there's ultrasound devices. And so these can be powerful or it can be effective in places where you want a little bit of change, but you really can't count on them for big changes. So like you'll see a lot of these devices used in like the face where like a little bit of a change can create like a more dramatic difference, but like none of them are going to create like a big lift. So again, energy devices typically reserved for the face. The one little caveat to that, there's a device out there called Renuvion. It's probably the best thing out there for creating tissue contraction in the body. But again, it's sort of like, you can't count on it to like create a lift. It's more of like to give you a little bit better than what it currently is. So what are your surgical options? I'm going to kind of go into each of these. There's arm liposuction. I sort of touched on Renuvion. I'll say a little bit more about that. There's mini arm lifts. Then there's traditional arm lifts. And then what I'd really like to get into is sort of this idea of like the arm lift plus liposuction. Because again, I think this is really where like the evolution of like arm lifts are going. So let's talk a little bit about arm liposuction. So arm liposuction patients are usually patients who are somewhere in like the 20 to 40-year-old range. And I'll tell you, even like north of about 35 years old, we start having to think about like the deflation effect of liposuction. So you really need to be pretty young or have really good skin elasticity, or you're talking about sort of minimal volumes so that if you do remove the tissue, you're not asking too much in terms of the skin's natural elasticity to contract. So young patients, good skin elasticity, mild to moderate volume excess, and they need to be tolerant of some skin laxity. So this is a patient that I recently treated, and a little bit more volume. The conversation I had with her was, listen, we're kind of rolling the dice on this one. You're young, you've got great skin elasticity, but I'm removing a lot of volume. So we need to be prepared that if you do get loose skin or skin that hangs, that the way that we would treat that is with a brachioplasty. And so we did it, and she came out great, and she loves it, and I know that we made the right play. I really wanted this for her because she was young. But why is liposuction not for everyone? So if we look at a patient that's a little bit older, I've done liposuction on this arm, but not on her left arm. And what you'll notice is after the liposuction, it's all empty. Do you remember that picture of the African-American patient I showed you earlier where like I had liposuction that's hanging? Like, yeah, you can't leave someone like that. So anyway, liposuction causes this deflation effect. And it really requires good skin elasticity. So if you're north of like 35, 40, like it's probably not going to be for you. And so if the elasticity is exceeded, the skin hangs. If it doesn't hang, it gets crepey. So even in like people who are pretty darn skinny, they come to me and they're older, liposuction is just not the right treatment. Renuvion is that energy device I was talking about. It's a probe that goes under the skin and it sort of cooks the collagen fibers to get some contraction. It does create contraction, and I found that it kind of gets the skin to kind of stick down a little bit, but I like to use it in these patients where I say we're kind of rolling the dice. Like, I'm concerned we're going to have a little bit of a skin elasticity. Let's just go for the best possible result. And so I like it, and I use it in those patients. But again, you can't expect it to create like the lift. Mini arm lifts. So mini arm lifts. Everybody wants to know about a mini arm lift because it's a minimal incision. It's a excision in the armpit that leaves a scar that goes in a fold. The idea is great, right? I wish it worked, but it's for a very specific patient. So skin incision in the armpit, minimal scar, but also limited lifting. The excision only goes, the lift only is created where the skin is removed. So I don't do a lot of these, and I've got some, but I usually still extend my incision down. I don't do that crescent. I went to the internet to see if I could find some photos for you, and I put in mini arm lift, mini brachioplasty, and this picture popped up like is on the first page, and this is exactly why mini arm lifts aren't for everyone. So why isn't a mini arm lift for everyone? Well, the extent of the lift is minimal. So if you look at this photo and what this patient has going on, she's got crepey skin and a little bit of like some droopiness like right by the armpit. And so when they did this, they got the lift, I guess, in the armpit. It's not quite as droopy there, but it really doesn't extend down to where like the rest of the problem is. And it can cause some unnatural pulling of the skin. You see that kind of thing going on like in the armpit? So mini arm lifts can be good, and occasionally you see a good outcome, but like they're just really not. You really need a very specific patient for that procedure. And so then that sort of leads into traditional arm lifts. A traditional arm lift is a more extensive excision, right? So now you're taking out skin wherever the problem is in order to create it. So I like to use this analogy of what's kind of looks like a banana. And so a traditional arm lift has an incision that goes from the elbow to the armpit. It can be extended into the armpit in order to do what's called an extended brachioplasty. And it leaves a scar down the inside of the arm. And that's really the main drawback of the traditional brachioplasty and why we don't just like launch ourselves into it. When people come and they want to talk about arm lifts, I want to make sure that this is something they've been thinking about for a while, that they're familiar with the scars, because that's the trade-off. We're trading contour and lift for a scar. You never quite know what your scar is going to look like until afterwards. There are some things that you can kind of like, some genetic things that can maybe like make you guess and stuff like that. But you just never quite know. So it's important to know that like that the scar is just a traditional lift. But it is the most effective and has the most lifting potential of all the procedures. So
we have a question.
Oh, you have a question?
Yes. Does he ever go down the forearm as well?
Oh, great question. So I do rarely. I really try and make a concerted effort not to go down the forearm because different parts of the body scar differently. And as you go past the elbow, that tissue tends to heal not as pretty. And it's in a location that's even more conspicuous, all right? So when we design a brachioplasty, and this is a whole nother, like this could be a whole talk, is like why do we put the incisions where we put them? But some surgeons like putting them down the back of the arm. Some surgeons kind of like down the inside. The idea is that you're trying to make the incision as inconspicuous as possible. People who like the incision down the back of the arm, well, they tend to like that because like when your arm's like this, you don't see it, right? And so if you're waving, well, then there's no incision. The problem with down the back of the arm is that when your arm is down your side, it kind of pokes out like this. People who like it on the inside of the arm say, well, you spend more time with your arms at your side, so that's probably more conspicuous. I think that if you split the difference and you sort of don't go right down the middle, you don't go right down the back, you kind of put it something like that, that's probably the most inconspicuous. But I've found in my own patients that as you sort of start to approach the elbow, the scar tends to get a little bit more red, a little bit more raised, and that happens to extend also down the forearm as well. There's a variety of reasons for that, but one of them is just that different tissue heals differently. For example, the outside of the shoulder heals particularly poorly. Faces heal amazing in front of the ear, but they heal differently behind the ear. Okay, so different parts of the body heal differently. Does that answer the question? Is there, all right, perfect. Let's talk a little bit about traditional versus extended, and I think I talk about this a little bit later, but why might someone want an extended brachioplasty? Well, if you think about the brachioplasty like this banana that tapers, you can follow me over here, that tapers at the end, we get the greatest lift where the excision is the widest. So as we move towards the end of the taper, you're not getting any lift here. A lot of patients who have lost weight or have bigger arms will notice that when they put their arm out, the distance from the top of their shoulder to the bottom of their armpit gets longer and wider. And the skin doesn't end here, it ends like on their chest wall here. And so in order to get a good lift in the armpit, I can't have my incision end at the armpit. I need to have my incision end down here, so I'm still getting pull there, okay? I'm gonna move back over here. So why are traditional arm lifts for everyone? Well, there's an associated scar wherever the skin is removed. And again, when I talk about that extended arm lift, my scar does extend into the armpit, but I've sort of moved to that for just about everyone, unless you come to me and you're just a skin person and it's not that much. If excess volume is present, so traditional arm lifts, what I haven't talked about right now is the liposuction component, okay? So if you've got larger arms and you don't remove the volume, well, you're tightening the skin, but the arm size hasn't shrunk. So there's a lot of tension on that closure. It's really tight. Incisions do not like to be under tension. There are four main things that affect what a scar looks like. We talked about genetics. We talked about the part of the body, how like different skin heals differently. Tension, the environment in which an incision heals. Incisions don't like to be pushed apart, pulled apart. If anything, they like to be pushed together. So when it's under tension, that's bad. And skin removal alone doesn't necessarily shape the arm. It's whatever volume you have. We talked about how you've got that volume on the side of the arm sometimes. If you're just taking skin, you really haven't changed that, okay? So this is a good candidate for what's just a traditional arm lift, just skin only. She's got crepey skin, but she's got the good like muscle definition. There's not a lot of volume. This is a good candidate for like a traditional arm lift. So then lastly, the arm lift plus the liposuction, what's that about? Well, so what we're doing in this case is we're using the liposuction to shrink and sculpt the arm. And this allows for additional skin removal. Remember that video where I showed like the arm had been liposuction, it was all empty? I can rotate out a lot more skin once that volume's been removed. And in fact, in this patient, I'm gonna come back over to this side, what you'll see here is this down here is actually the tattoo from the back of her arm. But because I liposuctioned all this out, I was able to rotate that around. So the back of her arm skin actually ends up on the bottom and inside of her arm because we've removed the volume, okay? And so this combination of liposuction and the arm lift really gives us the benefits of both of those procedures. So we get something like this. And that. And you'll notice there's my incision there in order to shrink the distance here, right? So if I ended my incision there, she would have a triangle arm that goes like this, okay? That gets wider as it comes to her armpit. I want your arm to be more like a cylinder. I want it to come into your armpit like a cylinder, okay? All right, so how is this done? So I don't know how much you guys know about me, but one of the most important features, and one of the reasons I'm able to do this the way I am, is I don't put you to sleep under general anesthesia, okay? So you are under what's called tumescent anesthesia, or a weak procedure. And so the numbing is an important component. And everyone's worried about it, but I can show you numerous videos of people walking in, walking out, having the procedure done. They're super comfy. But I numb the area first so that I then can have you position yourself in a variety of ways so I can nitpick, I can be more precise. When you're asleep and you're under general anesthesia, it's kind of dead weight. And I can't have you like hold your arm in a certain way so that I can check the proportions. Now,
so sorry.
Oh, you're fine. Come on in. So there's a numbing step followed by the liposuction to sculpt the arm and evacuate it, because now I can kind of pull this stuff over. And then there's a designing step where we actually clip the skin together before we excise anything so I can demonstrate to myself I like the shape and that it's not under too much tension. And then we do the skin removal. So this is a patient who we've numbed both arms. I've done the liposuction on one arm. You can notice that like I've kind of sculpted that arm. And on this side, where we haven't done the liposuction, I'm going to have trouble sort of rotating that tissue out, and it just looks bigger in general. And so I guess what I'm trying to demonstrate there is I can't really pull the skin around. So numb, liposuction, then we tailor tack things up. And all right, so I'm sorry. So we start with the liposuction, we sculpt the arm, we reduce the volume. That reduces the tension on the incision closure. Then we design it. So the skin removal is then sort of like planned as needed. So once we've removed the volume, well, those markings that I drew on you, they're just a guide. It's out the window, because that was my sort of prediction prior to liposuction. And it's another reason why I really like this, is I like to say this is customizable, because all of the predictions in the world, you know, don't really matter when I'm just trying to get a final result. So I sculpt the arm, reduce the volume, it reduces the tension on the incision closure. We then, the arm lift design, I often extend it into the armpit to get about a lift. And then someone is asking about when taking this down the forearm, I try not to extend this down the forearm because again, I think that like it doesn't look as pretty, it's more conspicuous. But so here I am trying to demonstrate this design. So I went ahead and I clipped the skin up on this side. So this side's they both have liposuction, and now I'm at the design phase. I've clipped the skin up to sort of show myself the brachioplasty that I want to get. I don't love this. Remember we were talking about that triangle arm? To me, that looks a little bit too triangle-y. So, triangle-y. And so this allows me then to go back and sort of change my design. Okay, I can re-clip things to get it the way that I want. We can take out a lot of volume too. I don't know if you can see it in the background, but that's the liposuction back there. That's, I don't know, probably close to 1.5 liters or 2 liters of liposuction from our arms in order to kind of get this. And then we do the closure. And so the closure is performed in layers. Again, that's like going to be a whole other talk. We use different types of sutures that are different sizes and made of different materials and are designed to dissolve at different time periods. I'll actually get into that a little bit later. Actually, well, all right. So let's kind of talk about some of the advancements and why this is different and why I think this is the direction that like arm lifts are heading. So one, this idea of local anesthesia. There are some benefits sort of medically. The less anesthesia we have to give you, the less your body has to process. And you know, patients sort of walk in and walk out without that sort of post-anesthesia effect where you need to like, you know, like come out of it and they're saying funny things and you're loopy all day. Patients will typically kind of walk in and walk out like not much happened. There's the sort of medical benefits, but I really like it because of the precision that it allows me, that the ability to nitpick is what I say. This idea of volume reduction in order to improve the shape and allowing that like additional skin removal. I've sort of talked about that a fair amount. This customizable, the being able to check my work and change things as needed. The extending it into the armpit so that we can get that cylinder effect of the arm and reduce this idea of the triangle. The layered stitching. What I found, and one of the sort of known things about brachioplasties is that incisions and scars can get wider several months after the procedure. In my estimation, the reason that is again because of tension in the skin. And if the skin is under a certain amount of tension, it needs to relax until it gets to sort of its desired tension. And the weakest part of that skin is the scar. And so the skin is expanding and relaxing. The scar is expanding and relaxing. I think the longer you reinforce the scar, the stronger it becomes, and the more it sort of asks the skin to relax rather than the scar. So I've got sutures that I put in that are designed to dissolve at 6 weeks, and I've got sutures that I put in that are designed to dissolve at 6 months. And the advantage of that is that I think that it like resists the scar spread later on. The downside of that is that you can feel that stitch, and sometimes there will be a pucker or a little divot where the stitch is until that dissolves. So you sort of need to be prepared that like things will be a little irregular, not smooth, where you can even sort of feel the hard thing underneath your incision for 6 months. No drains. Some people still use drains, and that's okay. Drains have a place. People are moving sort of away from them. What I like to do instead of using drains is the liposuction ports that I use, I don't close. And so we close a couple of them, but we leave a couple open so that you will just drain out of those incisions. And so for 1 day after the procedure, you will leak serous fluid. It sort of is like red Kool-Aid, all right? It's bloody water is what it is. But because you drain that out, we don't need to put an actual drain underneath the skin. So what we do is we put your dressings on, we put a compression sleeve on, and then we wrap your arm in chuck pads, which are like dog pee-pee pads, and then you will leak into those. And by the next day, when you come in to see me, that will have stopped. So it's really a 1 day phenomenon, and so I don't feel like we need the need for drains. And then lastly, negative pressure dressings. So a negative pressure dressing is a device that was originally developed for wound care. So maybe you've heard of a wound vac. These revolutionized wound care. So they were originally developed for like diabetics or people with big nasty wounds that like were malnourished and like they have a big hole in their leg and the tissue just won't heal. And they found that if you suck down on the tissue at a very specific pressure, it not only kind of pulls the tissue together, but it actually signals to the cells to heal faster. And so the guys that invented the wound vac, there was these two guys out of North Carolina, they won a Nobel Prize. This has revolutionized wound care. Well, they started using the wound vac on top of incisions that were closed in situations where they thought they were going to have problems with healing. Diabetics, radiated tissues, malnourished patients, smokers, things where they were like over a joint, oh, this is going to be a problem, it's going to fall apart. They realized not only were they not falling apart as commonly, but they actually were healing prettier. And so the cosmetic people got their hands on this and came out with a cosmetic version that's much smaller and can be like disconnected so you can go in the shower. It's really convenient. So it's a little box that connects with a tube to a dressing that sits on the top of the skin. So this is not a drain. It doesn't suck out any fluid. It is applying a vacuum or sort of vacuum sealing the incision. And so they make one that's for tummy tucks, and I started using this on the arms. And so this is a patient, we did a brachioplasty, and then we put this dressing called Pico on there, and it starts out and it's kind of spongy, and then when you apply the negative pressure, it kind of sucks itself down and kind of looks like hard paper. And then it's got this perimeter of tape around it that creates that sort of airtight, watertight seal. So, oh, we have a question.
Do you use all of the same techniques with revisions?
Typically, yes. So, when it comes to a revision, every patient is unique. We look at what's going on with that individual patient. But it's not uncommon that I'll see a revision patient that has excess volume. They had a brachioplasty, they had the lift, they had the skin excision, but maybe not the volume excision. So in those cases, yeah, we're doing liposuction, we're doing whatever they need. But a lot of times, a lot of the revision patients will sort of need a total redo. But so yes, this is the Pico. This is the Pico coming off. I can't remember if it was a week or two later. For patients who live out of town, you have a question? Oh, okay. We put on a Pico that's changed at 1 week, all right? So this thing goes on, it stays on for a week. You have to take it off in a week to see what's going on underneath it because it could be hiding something yucky. I've only ever had one infection, but I think part of it is because of this Pico. And because most of our patients are flying in from somewhere crazy, like this is also sort of like a belt and suspenders approach to healing, because not only does it help the healing, it also increases the circulation. So with better circulation, there's lower rates of infection, lower rates of necrosis, kind of the scary things. But you do have to do this at home if you are flying in, okay? And so you go home, you peel it off. It's just like a big sticker, and then we'll have to sit through this. If you are local, when you come in at 1 week, I actually will put on, the box can last for 2 weeks, in which case I'll put a new dressing on, and then I'll send you home with it again, and you come back a week later and we take it off again. So what I'm demonstrating here is that when you're taking this thing off, it actually is better to actually kind of push the skin away rather than peeling it off. In fact, I had a patient one time who peeled it off too fast, and she actually gave herself kind of blisters from like the tape kind of being ripped off. So if you kind of push away, that's better. But here we are at the Pico. This is why I love the Pico. This is amazing. So for 2 weeks after, this incision is like beautiful. Usually 2 week incisions don't look like this. And this is a great outcome. I will say though that like incision healing really is like a 6 week process, and that's once you get to 6 weeks, you're sort of at like your full strength. But then like scar spread and stuff like that, you do have to watch out for that, and you want to be cognizant of that for a few months afterwards. But anyway, so this is the Pico. That's how you take it off. I'm demonstrating that it does leave some lines and some creases. Little things like that are just from the tape. It's sort of like when you take your socks off and you see a little indentation from your socks. But I do, yeah.
Okay, so can you take the box off the shower?
Yes. Can you grab one for me?
Grab one.
Cool. So the box comes off the shower. You do need to be cognizant of, with dressings, compression dressings, all of these things, one thing that I kind of focus on with people is I don't love when the arm bends. Compression dressings, things like picos, they tend to buckle and fold, and they can create a crease and kind of pull in a way that you get a divot, and then you get swelling kind of above and below it. So we've actually changed our pico, the way that we do it, where we actually start the pico a little bit further back, and we're not covering the entire incision. And the compression dressings we're using until they give us a problem, which is like with swelling. All right, so this is a pico dressing. So again, this is actually the same one that we would use on an arm. It's just a big sort of sticky Band-Aid, but it's got this silicone perimeter, and then we put an additional perimeter of like some plastic sticky tape. But it goes on the incision like this, and it's got this little tail that hangs like that. So the box connects with what's called a lure lock. It just it twists in, and then you hit the orange button, and it seals down. And it is constantly sensing the pressure in the dressing and keeping it at 80 millimeters of mercury. And so it will rattle at you every once in a while to sort of like as it adjusts the pressure, which is totally normal. The rattling isn't a problem other than it's annoying. But as long as it's flashing green, it's working all right. If you are flying in from out of town, these can't go on the airplane. They are so pressure sensitive that the change in the cabin pressure cooks them. So we send you home with it, and then when you get on the plane, you have to take the batteries out of them until you land. All right, and then you hook it back up. Okay, but that's a pico. And if you want to take a shower, you disconnect it. This part sits on the sink, and the rest of the tail just kind of dangles, and that's how that works. Okay. So that's the pico. So recovery. So what does this look like? How does this fit into your life? So most patients, a lot of this has to do with like your job and the sort of demands of your life. Most patients will tell you they take 1 to 2 weeks off of work. I think if you are a work from home or retired, 1 week. If you are in an office or you use your arms a lot, it's 2 weeks. If you use your arms a lot, sometimes like hairstylists, I don't know, like people who like be cleaning something, like that might even be 3 weeks. For the first 3 weeks of the recovery, we're treating the incision like an incision, okay? For the second 3 weeks of that 6-week recovery, we're treating it more like a fresh scar, okay? So in the first 3 weeks, we're worried about, the scabs, maybe bleeding or infection because like there's a wound, little openings. And so that's why during that time, we'll be using picos or steri strips, which is like medical masking tape. All right, that sort of, yep, we got a question.
With extended brachioplasty, can you remove sweat glands?
Yes. So if we go back to, let's see if I can find that photo. So we commonly remove sweat glands. And that is sort of, we actually have had a few people ask about that. It's not intentional. It's just that this tissue is where all the sweat glands live. And a lot of times it's the hair-bearing skin also. And so in order to do my lift the way I want to, I'm taking that tissue that has the sweat glands. There's no negative consequence to that, other than you might not have to shave or use deodorant again. We don't, yeah, right? Yeah, we're not intentionally removing the sweat glands. They just happen to be part of the tissue that's going. Does that answer the question? All right. So when we think about a recovery, we typically say it's 6 weeks before the tissue is at its full healed strength. That's pretty uniform across the body. When you have a C-section, they say it's 6 weeks before you go back to the gym. When you break a bone, they put on a cast 6 weeks. We know that collagen doubles in strength every week over a 6-week period. So it starts out the first week, it's held together by the sutures, that's it. At the end of the first week, it's 5% healed. Second week, 10, 20, 40, 80, 100. That's a 6-week process. That's where the 6 weeks comes from. Now, that additional scar spread, again, that's until the skin gets to the tension that it likes. So that can happen months later. But once you get past 6 weeks, we typically say, go live your life. You are physiologically healed, all right? But when we look at that 6 weeks, I like to break it up into the first 3 weeks. We have a fresh incision or a fresh cut. The second 3 weeks, we have a fresh scar, all right? So for the first 3 weeks, pico dressing, scary strips. I don't really want you rubbing scar creams in or doing, putting lotions on because you have to think about that like a cut. The second 3 weeks, now we're doing things like scar tapes, scar creams. And if people really want to get into the weeds, into like post-operative scar creams and treatments, I'll be there to guide you and give, suggestions. There's a lot of cool stuff out there. There's this cool thing called Bridget. Like I said, that's a whole other conversation. I have plus or minus compression garments. I like compression. The idea behind compression is that it limits swelling. We know that swelling adds extra tension in the area. Incisions don't like to be pulled apart. So doing things to limit swelling is good. The problem with compression garments is that they also can cause their own problems. If you compress too much, you can actually limit circulation. Blood flow is needed in order to heal tissue. If it's really too tight, it can actually kill the tissue. And in my experience, I found that sometimes the compression garments can cause creases that then cause like swelling to sort of like accumulate above and below wherever that compression is. Plus or minus massage. This is, again, I could do a whole talk on massage. Massage is something that's commonly done for swelling, and it's commonly done for liposuction. The problem with massage and brachioplasties is you have a fresh incision that doesn't like to move. Incisions do not like to be pulled apart. So you really don't want someone that's pulling on the skin and shifting it around and moving that around. So if you're going to do massage, you need to make sure you've got someone who knows what they're doing and isn't creating like shear that's like, if you think about this as my skin and then this under here is my muscle, you don't want the skin and the muscle being kind of pulled apart, right? You want to keep those as sort of one unit so that you're kind of massaging like that. And so massage actually works really well over top of the compression because the compression is nylon, and so your hands kind of glide and slide over top of the nylon. So sometimes we'll say, all right, even if we've given up on the compression garment in your case, don't throw it away because we might put it on so you can massage. And then I have on there 6 months for swelling and scar improvement. You will see most of the swelling go away in the first 6 weeks. We typically say that like about 80% of the swelling goes away in the first 6 weeks, but that last 20% really takes 6 months. And we stop following at that point. At 6 weeks, we say, go live your life. That last little bit will go away, but don't drive yourself crazy, like watching it. And in most cases, like I don't want to say everyone, like at 6 weeks, they love the results. If it gets better, great. If it doesn't, fine. But just knowing how tissue heals. I will say, because of that bend thing, when getting a little bit of swelling around here, that area is an area that we kind of keep our eyes on over that like 6 months. And that requires a little bit more massage. Okay, it's an area where we do get swelling. And then scar improvement. Scars like mature over months and years. Okay, so in the beginning they will look red and raised, and then they will start to fade. But that fading process is something that takes months and years. And so once you get to 6 months, you'll start to really have a sense of like the character of your scar, and then you can start talking about like, well, if it isn't exactly the way I want it, like what are some other like adjuncts or interventions? Are there lasers? Are there scar massage? Whatever. So, let's see what else. All right. So common like questions. So why do we do extended versus traditional arm lifts? I hope I sort of explained that. Drainage tubes, we don't use those. I think I explained that. What if I gain weight after arm lifts? All right, well, in plastic surgery, we don't love huge weight changes after a procedure. You want to come in when you're sort of at your goal or ideal body weight and you think you can maintain it. If you gain weight, like when we do liposuction, we've removed fat cells from those areas. They're not coming back. Now, we haven't removed all of the fat cells, so the ones that we leave behind can still grow and shrink. But when you remove something like 2 liters from an arm, that probably won't be the area that like grows the fastest when you gain weight. You will proportionally have less fat cells there than you did beforehand. So if you were to gain a bunch of weight, it might go to somewhere else first. Okay? And then in regards to the other direction, so weight loss, we tell people, listen, if you are thinking about an arm lift, but you want to lose 20, 30, 40 pounds, do that first, okay? You don't want to do an arm lift and have things all looking all great, and then lose 30 pounds, and it deflates again. Because then, you know, like that's what happens. You let the air out of the balloon. 5, 10 pounds, probably fine. 20, 30, 40, lose it first. And like, we're now in the like age of Ozempic and Wegovy, semaglutide, like that's not unheard of. So if that's your goal, do it. How do I care for my scars after the arm lift? So we talked about the sort of 2 phases of like the incision part and then the scar part. The science has demonstrated that probably the 2 most effective like non-energy treatments for that like time period between 3 weeks and 6 weeks is either scar tape or some form of scar massage, which scar tape is typically silicone tape that goes over top of the incision. It creates something called contact inhibition, which is that like it sits on top of the incision and the cells that are kind of gluing themselves back together sense that that's up there, and so instead of growing up, they go across or down. And then scar massage is actually the manual manipulation of the scar. They've shown that that actually helps the collagen fibers sort of reorganize. You don't want it pulling the incision apart, so when you're doing it, you sort of do it in the direction of the incision, but that actually helps the scar mature faster. And there's a variety of things that you can put on the scar. Silicone, most of the scar treatments these days have silicone in them. The reason that is actually because the scar tape is made out of silicone, and that was so successful that they started like putting that into the ointments. But not all scar treatments have to have ointments. They think it's actually the manual manipulation of the scar that's actually important. Yeah.
Do you recommend hyperbaric oxygen treatments before and after to promote healing?
So hyperbaric oxygen is great for tissue healing. It's a little aggressive, or it's kind of a lot. So hyperbaric oxygen is you go into a chamber and they increase the pressure of the oxygen. It's pure oxygen at high pressures, and it kind of drives it into your circulatory system, so it's delivering high concentration oxygen into the tissue. And it's shown to decrease inflammation, increase the sort of how well the tissue heals. It was typically reserved for when people had problems. So if you had necrosis, like because the tissue didn't have enough blood flow and it was too tight, you did hyperbaric oxygen to get you out of problems, or an infection. It's used in infection. But they've started using it more and more, and it's actually, when we're talking about advancements, this is like one of those sort of advancement things in order to aid in healing. Now I'll tell you, hyperbaric oxygen, the real stuff, the stuff that's really been studied and is really effective, you go into a chamber that is made of metal, and it takes several minutes to get the pressure up to where you need it, and it takes several minutes to let the pressure out. That's a big pain in the ass. People can get claustrophobic. So they now have in-office or home hyperbaric treatments where the pressure isn't as high. I think they're still effective. They're not, but that's not like the stuff that like the science says is like, you know, for like infections and necrosis and stuff like that. So it probably helps. And if you have access to that, it's great. But I'm not recommending it routinely with my patients, but it's a cool thing. And then, like I say, if you're interested in that and have access and the resources to do so, yeah, it's only going to help. It's not going to hurt. Can I undergo an arm lift if I still plan to lose more weight? Yeah, I kind of touched on that. No, yes, but wait until after you lose the weight. How much time should you take off work? Very job and lifestyle dependent. Minimum of a week, and a maximum of 3 weeks. What we're trying to avoid is we're trying to avoid stretch and pull on the incision. We're trying to minimize the spread at the arm or at the elbow where the stitches can be, and we want to minimize swelling. The more active you are, the more swelling, and it doesn't just have to be the arms. So the way the circulatory system works is you've got blood vessels that are connected to one heart, all the same blood vessels. So if you were to sit on a stationary bike and spin your legs, your heart rate goes up, your blood pressure goes up, your arms will swell. Because tissue that's been operated on is leaky. It's a physiologic process where like the blood vessels actually, the cells separate to allow the healing cells to get in. And so they will dump fluid into the area that was operated on if you were to do like a stationary bike. So think about your lifestyle and how this fits into your lifestyle, because this affects the healing and the scars.
Do you ever do a little lipo on forearms?
Yes. So forearm liposuction is like, I don't know, it's like a thing that, I don't know, like plastic surgeons debate. We're doing it more. But, we can do a virtual one where we're sending photos. I like photos because it allows me to kind of zoom in. If you want to do like a video thing to sort of demonstrate something to me, we can do that too. Scarlett, our patient concierge, will send you a quote to your email. You get to kind of think it over, and then if you have some more questions, we can talk some more. Scarlett's also the person that knows my schedule. So then you start thinking about like, all right, how does this fit into my life? And like, when's the right time to do this? If you're thinking about dressings and your help and compression garments based on the season, then you get with Scarlett and you say, all right, like, what do you have available? And you kind of try and coordinate that way. And then once you're in our pipeline, we sort of have a process for making sure that we get like any lab work that we might need. Not everyone needs lab work if you're young and healthy, but if you have some medical conditions or have something that needs to be monitored, or you might need some more recent lab work. Denasia, my nurse, will go over the preoperative instructions, the postoperative instructions, so you know exactly what to plan for. We like to try and make this as like seamless as possible, so we'll try and anticipate your needs beforehand. We order your medications from a local pharmacy who has them delivered to us. We have them all waiting for you. So you just show up on the day of your procedure. It is different in that because you're awake, we don't need you to like be NPO or like not eat and not drink anything the morning of the procedure. We actually prefer that you eat or drink before, so you come in and like you're not dehydrated and your blood sugar is low. And so that's part of the thing that Denasia goes over. Scarlett also sort of pre-schedules your follow-up appointments. And if you're from out of town, those follow-up appointments are you send in photos. And the idea there is that we like the photos because we can kind of zoom in on things better than the video. Question?
Off topic, but will he combine a breast lift too if he wanted?
For this and what I'm describing, no. Because when I do breast lifts, I do them asleep. That patient from Alaska I was just talking about had a tummy tuck and an arm lift, and I did that asleep, but she was a good candidate for the arm lift because I didn't need to do extensive liposuction. And so that was sort of a unique situation where I was able to do that. But for what I've described in this scenario, where we're really doing pretty significant liposuction, I can't do that with an asleep patient. I mean, like, that's really where like the sort of like the moment was where I was like, okay, I need to put these two together, is that you're doing this really cool kind of like arm liposuction plus the brachioplasty, and you just can't do that cool arm liposuction with like dead weight. When we're doing the procedure, I have patients sort of rotate or demonstrate their arm to me in ways that allow me to kind of nitpick and get things just the way I want them. And then, that's it. We'll do some questions here, but I guess I just want to end this. This patient sent me this photo, and it's just like really powerful for me in that, this was her before photo. This was her after the brachioplasty. This was, the consult photo she sent me. And I mean, this is just like one of these, like I'll tell you, like, patients who struggle with their arms can really struggle with their arms. And if this is the sort of thing that you're experiencing, I just want you to know that like there's stuff out there to help you. And like, if this is going to make you live your life and live like a better life, so we talk about like sort of like quality of life improvements, like there's stuff out there for you. Okay. So I want this to like feel empowering. I want this to feel encouraging. This should be fun. Okay. Like, this shouldn't be daunting or overwhelming. All right. Like, this is for, I can't tell you how many times we've been in a procedure
and we stand up to check everything at the end. And the patient says, oh my God, I can't believe it took me this long to do this. I should have done this a decade ago. So anyway, I'm here for you. I want to help you. And if I can be a resource in any way, or if you live somewhere far away and you're like, oh, listen, I don't know, like Florida's too far away or whatever. But I want to know more about brachioplasties and I want to like pick your brain. I'm here for that too. We do consultations all the time and I say, hey, listen, for whatever reason, you're better suited finding someone closer to you. Or let me help you find someone. I'm cool with that too. That's it. Do we have any questions? If you want to get in touch with us, you can go to our website. There's a link where you can sort of send your contact information. We'll reach out to you. Send emails, the phone number, all this stuff. You just Google Florida Plastic Surgery or my name. You'll figure out how to get in touch. So, yeah.
I've heard of undiagnosed lipedema that can it regrow if not removed correctly.
Lipedema is an interesting topic, and I will tell you a lot of these patients have lipedema because lipedema patients tend to struggle with their arms, and fat can accumulate in their arms to a greater extent than other places. And I've come to realize that like arms play by a different set of rules. They sometimes grow with the patient, but don't shrink with them. And so can lipedema fat regrow? I guess the answer to that is like, sort of. The fat that we remove, the sort of current thinking is that fat is gone. But the fat that we leave you with, yeah, that can still grow and shrink. And we don't take all of the fat. We can't, you don't want me to. If you take all the fat, you're going to damage the muscle, you're going to damage the skin. It's going to leave things looking dysmorphic. But we do try and get out as much of that, I'm going to use the word diseased fat, as possible. But also in a way that's also aesthetic. I think that like, I don't really know if like we've really helped someone if we've like gotten rid of all of the lipedema fat, but then they've got these arms that they're like aren't super happy with. I don't know. The goal of this is for you to like live an empowered life. So yeah. Does that answer the question? Okay. Anything else? All right, cool. Well, to all of you that like braved the rainy weather today in Florida, we're not used to this. So like, thank you. And for everyone else who tuned in, thank you for your time and your attention. And like I say, this is like one of these things that I've really come to like have like a special place in my heart for like arm patients. So if I can like be a resource in any way, please feel free to reach out. All right. Thanks, guys.